Nassau, the Bahamas. It's time for Your Lane with Coach Trish Hanna.
Yeah, it's time to empower, educate, and encourage your women to motivate you through whatever you've been going through. We can talk about it. We ain't passing no judgment. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever your real life looks like. Stay in your lane. Come out the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. Tune into Your Lane Talk Show. It makes us feel good just to know we're not alone. No more we've been isolated and cast aside. I want you to come out the dark. Just don't be afraid of your heart. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever your real life looks like. Stay in your lane. Come out the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. It's Your Lane Talk Show with Coach Trish Hanna.
Hello, 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 and welcome. Happy Sunday, everyone. This is Your Lane Talk Show with your coach, Trish Hanna. It's awesome to be in your hearing once again. For those who are tuning in with us for the first time, Your Lane Talk Show was created to educate, encourage, and empower women of all ages. Last week was hot. I mean, it was so hot. They was talking about it in church and they couldn't even talk about it so much because we had some children in church, so we had to keep it down, you know. But last week we had with us relationship and sex specialist Maggie Bain on board, giving us a scoop on how to enhance our intimacy, right? And help couples who may be experiencing difficulties connecting in their relationship. Under the topic, help, I think we're disconnected. And it was so informative. I love the energy that Maggie came in with. She was just so profound. The information, people are saying thank you. I actually got a few inboxes, and there were some persons who asked questions, some persons that WhatsApp me. I posted it on Your Lane Life Coaching's Facebook page. And so what she was able to do was when she saw those, and I tagged her, so when she saw the questions, and she was able to answer those questions for those persons who were, I guess, wanted to be a little bit discreet instead of actually calling in or typing in their questions on the live. Now you can watch that show on YouTube. Just search Coach Trish Hanna, Your Lane episode 55, Help, I Think We're Disconnected. And when you do go there, please like and subscribe. Hey, thanks. All right, so now it's time for you, because I don't want to delay this anymore, because today could be hot. Today, I sweating nah. We even didn't start and I done sweating. Today is going to be juicy. To call your loved one, call your friend, call your sister, call your neighbor, call everyone who you know got a man. And it don't have to be your husband, your boyfriend, or whomever it could be, because they still have a father that's living. They still have uncles. They have nephews, whatever have you. Because we want to talk a little bit about the men in our lives. We want to ensure that they're healthy, they're strong. We want the information so that we be able to handle them effectively and efficiently. We want to be able to understand them a little bit more. So we're going to be covering topics regarding even intimacy, regarding, prostate, regarding their mental state, all of the above. You think of it, we're going to try to cover it as best as we can on this show. All right. So what you can do now, for those who don't know, that the dial for FM, the FM dial is 106.5. Okay. 106.5 FM if you want to tune in on the radio, or you can go to channel 976 on cable, or you can log on to Facebook on Your Lane Life Coaching Facebook page, where you'll be able to watch us live. We have with us in studio a urologist who will be speaking to us about our men's health. Now, this is a part 2, because last year we did episode 11 with the urologist Dr. Joseph Evans. All right. So those who are watching us on Facebook, please like and subscribe. This is part 2. So we're going to see if we can compare and contrast because both of them are excellent urologists, but one is more, a little bit more modern, I think. One is a little bit more modern than the other. And the other one last year admitted that he is old school and that's just him. You know, it is what it is. According to him, you know, things may change, but whatever he was doing worked perfectly fine. Excellent, excellent doctor. Salute you, Dr. Evans. You're in episode 56, What We Need to Know About Our Men Health, Part 2. What we need to know about our men, Part 2, is brought to you by Airborne Freight and Cargo Services, John's Shoe Store and Accessories, Your Lane Life Coaching, Bahama Odds and Ends Party Supplies, and Johnson & Johnson, distributed by Lowe's Wholesale. Summer's here. Grab your Johnson & Johnson skincare. This summer, during the months of June and July, purchase $15 or more of any Aveeno, Neutrogena, and Clean & Clear products and enter to win one of 3 amazing prizes. A $500 travel voucher, a $250 John Bill gift card, or a $150 Visa gift card can be yours. All you have to do is just purchase any one of those products, pop into one of the Lowe's pharmacies or any participating retailer and enter to win. And there you go. You might just have one of those 3 items or 3 of them. We don't know. What are the chances of that, eh? Promo ends July 31st. Our guest, dun, 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 Dr. Greggory Pinto is in the building. Dr. Pinto is a Bahamian born and raised urologist and laparoscopic surgeon, the son of veteran educators Alan and Joanne Pinto, and the nephew of national hero veteran educators Marjorie Davis and D.W. Davis. Did you know that? Oh. Dr. Pinto holds a degree in minimally invasive laparoscopic urological surgery from the University of Strasbourg, France. Did I say that right? Because I'm speaking in tongues now. Having worked in South Africa, Germany, and France, he is a board-certified urologist and laparoscopic urological surgeon and a member of the European Association of Urology. A devoted family man and Catholic, Dr. Pinto is an active member of St. Francis Xavier Cathedral. Thank you so much for being with us today on Your Lane Talk Show, Dr. Pinto, and welcome.
It's my pleasure to be here. Thank you for the invitation.
You are certainly welcome, Dr. Pinto. Now, I don't know how we're going to do this, but we haven't really had a nice, we normally do something like we'll say, what would be our predictions for today's show? Now, I was feeling you a little bit to see how today's show is going to be. You ain't seem too comical. You just seem more laid back, you know, you just chilling, right? So I would say 100% aha moments today. I would say 100%. I don't think anybody crying, so 0% teardrops, 0% laughter, because you ain't seem like the key type. You just went get your information out. This is what you need to know. I get home, right?
Well, it's some serious topics. Information try to improve the quality of lives of listeners and not only improve the longevity of their life, but the quality of their life on this earth. Yes.
Yeah, today is aha moment day. All right. Okay, I could try put one or two joke there on the side just to keep you all going today. But bring your pen and paper because we can need it. But blessings to you and thank you so much, Dr. Pinto. So I like what you said. You said you want to be able to help with the longevity of the lives of not just men, because you do have some women that come to see you also.
Well, I mean, it's a major misconception that urologists are just for men. We see just as many women and children as well. So it's anything that has to do with the urogenital system, males, females. There's some overlap with gynecologists in our field as well.
Wow.
The bladder, prostate, obviously men only have a prostate, kidneys as well, and that includes kidney cancer, bladder cancer, prostate cancer, testicular cancer, penile cancer, anything that related to the bladder in terms of stones formation, urinary tract infections, overactive bladder, urinary incontinence for men and women. So essentially, no matter what your race, whatever your sex, your creed, your age, you should not allow the bladder to control your life. There's no need to worry about not having a glass of water or some wine with your friends or beer with your friends, and you have to know where the next bathroom is.
Yeah.
Scared to have a drink of water before you go in traffic because you know you're just not going to make it to the toilet in time. Afraid to drink past 5 p.m. because you're going to wake up all night to urinate. So you have to listen to your body. If bladder is controlling your life, something's wrong. And as urologists, we can get you back control of your bladder and your happiness.
Oh wow.
Okay.
Yes, yes. And it's amazing that you say that because you do have, and I see lots of commercials on TV where they talk about overactive bladder, especially with women. I just thought that was something that I know with me. Sorry to say this, when I was pregnant, about in my 8th month or so, because the baby was so heavy on, the bladder, I'd be like, oh, I gotta go. You going to the bathroom again? Yes, I'm gone. I thought that was only for me, but I didn't know that we have women my age, a little younger, and so having issues with their bladder. If they laugh too hard, that's it.
Yeah, if they cough, they sneeze, they laugh, they pee at the same time.
Oh my goodness.
It's a tragedy that doesn't have to happen. There are too many women in this country that are living with a panty liner or a shield or worse, adult diaper, and they have that indignity of always perceiving themselves as smelling like urine.
Yes.
They're socially awkward. They withdraw from society. It affects them professionally as well, affects their relationships.
Yeah.
And it doesn't happen. Even with intimacy, they're afraid of leaking urine at that moment. So always listen to your body. There's no shame. The greatest tragedy and shame is to continue to suffer in silence. There's so many persons in the same predicament as you. Some are suffering with a more severe case than you, and you'd be surprised. It might be your colleague at work, might be the person in your pew at church, it might be your cousin. But if everybody's going to live with this in silence and go on the rest of their life with that indignity of their bladder controlling their, always smelling like you're living their life, where's the next bathroom, that just deteriorates the quality of their life, socially, professionally, and in terms of even their self-esteem. So stop living like that. There's no need. And then I'll even go further to children in the bed. If you're a child over the age of 5 or 6 who has the tragedy, and it's one of the greatest tragedies a family can face, it's not just a child. Studies have shown that it's the 3rd greatest tragedy a family can face, that your child is wetting the bed. Imagine you're 14 years old and you've been wetting for 8 years, almost every single night, soaking the bed, soaking your pajamas. You may have a you never go on field trips, never have sleepover with friends. It affects your development in terms of your personality, and it's a tragedy. As a urologist, I've seen persons wet their bed for 10 years. That night we can do something about it and they're not wetting again.
Wow.
Yeah, so stop living that tragedy and that indignity. Stop with the panty liner, stop with the shield, stop with holding liquid intake because you're afraid you're gonna have to pee all the time. That in itself can lead to other problems.
Yeah.
Kidney dysfunction, kidney stone formation. So you need to have adequate water intake, and you need to control your bladder.
There are times when children, I know this, we're talking about men right now, but because you mentioned this, there are children that may have a little accident. Is that still an issue? And I'm not saying that it happens every single day, but let's say, they drank too much and they stayed up late or whatever, and then they go to bed and just too tired or too sleepy to go get up.
Well, it's age dependent, of course. There are some persons who have, 5, 6. If it's over 6, then it's something we need to look into. Right. But there are kids who are 7, 8, and they basically, because they don't want to stop playing, they may push it to the edge and they may leak now and then. But it's different if there's actually a physiological issue that's causing them to pee when they're asleep. Their body's not being told to wake up to urinate. It may go further. We need to determine whether they're having a problem during the day. Do they have to rush to pee every period? Are they always asking the teacher to be excused to urinate? Are they afraid to even drink something at lunchtime or at snack time because they have to run and pee?
What happens to those who want to just hold in their urine so long, and then because they hold it in so long, it just
that in itself even happens with particularly women. They call it the secretary's bladder, where they'll hold the urine in for 8 hours at a time. That in itself can cause issues with your bladder and being able to empty completely. So it's not as if every time you feel the urge, you got to run and pee.
Right.
But if you're waiting hours and hours every day to urinate, day in and day out, it can have a problem with your bladder going forward.
Wow. You just reached.
I just like to say,
Go
that
ahead, Beats.
I was a former bedwetter.
Yeah. How old were you when you stopped?
Stop. I don't know exactly.
You go see him tomorrow.
I don't know exactly how old I was when I got a handle on it.
Yeah.
But it really sort of like culminated on. It would be like I would be having a dream, and then I'd go use the bathroom in the dream, and then something in my brain would be like, hey, pick up, babe. Go to the bathroom.
That happened to me before. Honestly, I think I was about 10 or so. I thought that I was urinating in my dream, and it happened, but that never happened again. So,
you have the dream where you're swimming. That's a telltale.
I never had that one.
If you're dreaming that you're swimming, go to the bathroom.
What are your thoughts?
I mean, we're talking about isolated issues. You might be overly fatigued. You may have had too much in terms of alcohol consumption. That also can lead to. But I'm talking about kids that 5 out of 7 days, 7 out of 7 days, every year in and year out, from the age of 6, sometimes even the age of 18, 19, 20, they're wetting the bed. Imagine the tragedy of that. It affects them in every aspect in terms of their development, their self-esteem, and even their relationships with friends and their family and everything. And then imagine the stress on the parents. Imagine the stress on the family unit. Imagine the lack of sleep they're getting because they have to wake up and they're soaking wet.
Yes. And
that itself, a child needs a good 7 hours sleep before they go to school. Absolutely. So if every single night they're waking up 3 a.m. because they're soaked, and they're spending 40 minutes changing themselves, going to bathe, putting on pajamas, the depression related to that, the indignity that they feel, it's tragic, and it doesn't have to happen. Yeah. It's called nocturnal enuresis. There are many reasons for it, but most of the time when you have primary nocturnal enuresis, we can look at behavioral modifications, and we need to rule out something which is quite common in society. That some studies say maybe as many as 1 in 15 kids have that problem to some degree.
That's something. Okay, so we're gonna go back on topic, guys. This is just so interesting that we have urologists here that deals with men, women, and children,
yes,
alike. So we wanted to just get that out there, but we want to focus mainly with just trying to educate our women in terms of how our men's health should be, and how we should respond, and be informed about what's happening with them. Have a better understanding. Why do you think that we as women should be what's the word I want to use? Should be
proactive.
Proactive, that's a good one. But that why should we be more intentional about, or should be intentional about, our men's health, particularly wives with their husbands? Why do you think that's important?
Well, the health of the nation is the wealth of the nation, and if you love someone, you're going to want to have them with you as long as possible on this earth in good quality life. I mean, if you're going to ignore your health and then you live all your years trying to give the best for your family, and then all of a sudden in your later years you're a burden to them financially, emotionally, in every other aspect, it's something that doesn't have to happen. There are too many men in the society who are literally afraid to go see a physician. The women have to push them, and then you talk about they know something is wrong, something is going. So all of a sudden there's a change. They're waking up 5 or 6 times a night to urinate. They're putting on 70 pounds in the last 2 years. They don't know why. They feel sluggish, lethargic. Their erectile function is not what it once was. Their sexual libido is not what it once was. They're suffering from headaches, blurred vision, chest pain, shortness of breath. They can't walk up a flight of stairs without being exhausted. They don't have any energy whatsoever. They're always falling asleep. TV is always watching them. They can suffer from depression. They can have a change in their personality. There's so many things that can happen as you get older. And in a lot of men, they just deal with it in silence. And then we look at things that happen that have no symptoms. And that includes prostate cancer, which is the #1 cancer afflicting men in this country. Yes. If you're waiting for the symptoms to happen, you're waiting till it's too late. For the vast majority of cases, when you have early disease, you're not going to have any symptoms whatsoever. Prostate cancer is killing far too many men in this country in the prime of their life.
Yes.
And it's not a immediate death. It's a slow progressive death where you can become a burden to your family. If you don't like going to the doctor, you'll be in and out of hospital for those 10 years of your life where we're giving you palliative care.
Oh, child.
But prostate cancer is the easiest cancer to treat. Of all cancers, if you pick it up early, your chance of survival at 5 years is 100%. At 10 years is 98, 99%. So it's a very survivable cancer where you don't even necessarily need surgery. Men afraid of pain, we can do minimally procedures without any recovery that can cure you of cancer, and it can just be a little small bump on the road that we can do again. You're back to work on a Monday.
I love that. You go a little ahead of it, which is good, because one of the questions I want to ask is, how do we as women convince our men to go and get a checkup? That's something that I've heard last year with Dr. Joseph. He said it's very hard to get men to go in to get a checkup for whatever reason. I mean, I don't know what the reasons may be. You may come up with a few.
Well, the most important organ for a Bahamian man is their male organ.
Yeah.
And if you can instill in them, if they want to get that to continue to work in the best tip-top, you got to have good control of your health.
Yes.
So erectile function is a manifestation of good health. Your cardiovascular health. If you're going to have anything affect the blood vessels, it's going to affect the smaller blood vessels before the larger blood vessels. So it'll affect the small blood vessels affecting your male member long before it affects the blood vessels that supply your heart or your brain. That can be an early sign of something sinister going on, such as early cardiovascular disease, atherosclerosis, coronary artery disease, hypercholesterolemia. If we can pick that up early, not only can we get your erect tract, we can probably prevent you from getting a heart attack, a stroke 5, 10, 15, 20 years down the road. So always listen to your body. So it's not just that you want to go to the gas station and get a unregulated medication that may help you with unknown side effects. If you're going to get medication from the gas attendant, you know there's something wrong. Or even borrowing something such as Viagra, Cialis from a family member, you need to, in medicine, you want to deal with the cause, not the symptoms. Obviously, yes, we'll give you something that will give you back your confidence, get you a boost, get you back on track. But we need to, why are you having erectile dysfunction? Is it low testosterone, which can happen to every man by the time he's middle-aged? From the age of 40, your testosterone is going to fall 1 to 2% per year. Every man.
Yeah, I'm doing all my questions.
And some men levels and others, some men will drop rates in this, and there are many reasons for that, including obesity, including obstructive sleep apnea, which is linked with low testosterone. It's a vicious cycle. If obstructive sleep apnea, you're going to have low testosterone. If you have low testosterone, it's going to make the obstructive sleep apnea worse, which is going to lead to obesity. The obesity is going to make obstructive sleep apnea and low testosterone even worse. So you never get off that vicious cycle where all of a sudden you have no sexual drive, erections are poor, you're putting on weight, you're feeling lethargic. You may even be in the male version of menopause where you're feeling heat intolerance, you're prone to depression, irritability, your whole body habitus, your whole outlook in life can be changed, your whole personality can be changed just because of that one thing, low testosterone. And we have to look at, why do you have low testosterone? We just don't give you testosterone. That in itself can be extremely dangerous because, for example, if you have early prostate cancer, we give you testosterone, that prostate cancer is going to proliferate, progress rapidly. It has nothing to do with testosterone causing prostate cancer. Is that once you have prostate cancer, what the prostate cancer requires to progress, to proliferate, and to spread, and to progress is testosterone. But if you think about it from this perspective, when do men have the highest levels of testosterone? In their 30s. Nobody gets prostate cancer in their 20s or early 30s. So there's that correlation isn't, I don't want that misconception put out there that testosterone causes prostate cancer. But once you have prostate cancer, if you give someone testosterone, it can be tragic because you can have early disease that can be easily cured, all of a sudden become even advanced in metastatic. So we always need to rule out even early prostate cancer, we said earlier, usually has no symptoms before we can use testosterone. We also need to pinpoint why you have low testosterone, which is medically called hypogonadism. Is it primary? Is it secondary? We need to pinpoint the cause of that and not only just give you testosterone blindly, because let's say you have sleep apnea, we give you testosterone, that'll make the sleep apnea worse, and that'll make the low testosterone even worse. So you'll never get cured of the problem. So it's always identify the direct cause as we're treating the symptoms, and then once we treat the direct cause, we can prevent other damage to other organs such as your heart, your liver, your eyes, your vessels, your brain, preventing you from getting a stroke, heart attack, etc. You can develop something called metabolic syndrome as you get into middle age, where with low testosterone, it can put you at risk of developing diabetes later in life, hypertension, hypercholesterolemia, obesity. If you have one of these pre-existing comorbidities such as diabetes, hypertension, or hypercholesterolemia, it can be more difficult to treat it. So all of a sudden you have your diabetes for 10 years and you're 52. All of a sudden it's erratically controlled. You have high levels all the time. It may be tied in with metabolic syndrome, low testosterone, which may be related to obesity, which may be related to sleep apnea. So you got to have you urologists basically determine the root cause, treat the root cause, so we can get you back to healthy living.
I love that. You said the whole show. I could pack up and go now because you didn't answer all the questions. I was saying pull up. So the very last question I recall asking before we started talking about the libido, right, was how do we get our women to convince our men to see you or go and get a checkup? And and from what I gather from everything you said is, hey, listen, if you care enough about your genitals on any part of your body,
correct,
but primarily your genitals, go and get a checkup, because you want to make sure that your heart is in the right condition, you have your blood vessels are flowing properly, prostate is intact, testosterone levels are accurate or whatever the levels that they should be on, in order for you to function effectively. And of course, even in all of that, you want to be able to be a good spouse. You want to be able to go out to dinner and go run around and laugh and joke and have fun. You don't want to be lethargic. You don't want to just be in a state of depression. And then you wonder why these things are happening to you. You didn't go and get a checkup. What did the doctor say?
Well, I mean, you can use the motivation that what the current situation is. Men don't like doctors. They don't like hospitals. They don't like needles. They don't like taking medication. If we don't address simple comorbidities like high cholesterol, diabetes, hypertension, when these things cause irreversible damage to your kidney and you're on kidney failure and you have to have dialysis 3 times a week and they're trying to put you through surgery to put in a perm catheter, and then you lead to arterial venous fistula, which will go down, or you're trying to wait for a kidney transplant. So the average person in this country who's on dialysis may only live 2 to 5 years. Obviously, there are those who live a long lifetime, but erections are gone. So use that motivation. If you're in kidney failure, erections are gone. If you haven't controlled diabetes for years, your erections are gone. If you have high blood pressure, which has little to no symptoms, they call it the silent killer, it's going to kill your erections. So men use that psyche that they want to keep their erections. They don't want to go to the doctor. So just go see a physician even once a year for annual physical. Get stuck once, get all those routine bloods done, and let's make sure we get on top of your health before something happens.
Absolutely. Prevention is better than having to have all these things stuck up in you
Correct.
At the end of the day anyway, and then you don't get to live as long because you didn't want to take the time to go and get an annual checkup.
But you'll get your car tuned up several times a year. You don't want to go to hospital, but if you let these things catch up with you, you'll be in and out of hospital for months on end,
and not only
for many years.
It affects your finances as
Exactly.
well. All right.
So what's the point of working so hard to save in your golden retirement years if it's just going to be used all up on medical expenses?
Guess what? I love that, because that's what I wanted to start off with. I wanted to start off with the importance of knowing your going to get a checkup, getting your annuals. And as women, we're pushing the men in our lives, our fathers, our sons, our nephews, our husbands to go out, boyfriends to go and get a checkup. All right, because we don't know what's happening. You may feel fine, because there are some things that are silent killers, as you mentioned. All right, but it's best to go and get a checkup so that you could prevent future issues from occurring or happening in your life. All right, so we're going to take a quick break. And if you want to, for those who are listening via radio, come on down to the Facebook, because we're going to be talking some stuff on this Facebook Live. So let's take a break, Beats.
you buy it from?
So one of the questions I wanted to ask is, all right, someone says, get your checkups and prostate exam. Absolutely. You got to do it. You got to do it. And
so there's a misconception in the last 8 years or so. There's been a shift in terms of how do we pick up prostate cancer. For primary surveillance for prostate cancer, we don't need the dreaded digital. Even the American Urology Association has taken that out the equation. So that's, a lot of men are terrified of getting prostate cancer screening. I put the word out all the time. I write in the paper. I'm in the news. The word.
You don't have to do it.
Go to the American Urology Association, which is a governing body. It'll tell you for primary care, surveillance of prostate cancer, you don't need the digital rectal. We're picking up. So there's a misconception that if your prostate feels abnormal, you have prostate cancer. We want to pick up prostate cancer when the prostate feels normal.
Right.
So we have more specific blood tests. We have urine RNA tests. We have imaging that can pick up prostate cancer 5 years, 8 years before the dreaded finger.
You got a question?
No. I was just imagining like a guy goes in to get his prostate exam, and he's like, "All right, doc, let's just get this." So we start putting. Doc is like, "What are you doing?"
Yeah, but I see the thing about it is, let's say I do that and the prostate feels normal. That doesn't mean you don't have prostate cancer.
No, it's like,
yeah. So it's really of no purpose.
Let me ask a question. Is that like, what about, okay, you now have the advanced technology that you don't necessarily have to go through the anal cavity, right?
Yes.
To do that, right? What about persons who had to experience that? Is there a side effect? Like, is there like a mental psyche issue, like for a man? No, I gotta be real.
Very much so.
I'm
yes.
telling you, isn't it so?
They might go once, they'll never go again. And how is that serving our society? How is that serving the individual? So anything in medicine, we have a benefit of doing it. First, do no harm.
Right.
That is causing thousands of men never to
go back.
Address the prostate, and the prostate cancer is the number one cancer in this country, even far exceeds breast cancer.
So how many times do they go to get a check? Because if you're already going to...
All you need is from the age of 40, a blood test, which you're going to get for other reasons anyway.
Right.
To a little extra tick of the box, which is standard anyway, looking at your prostate-specific antigen blood test. There are more specific bloods that can be requested if that's abnormal.
Okay.
Okay, sorry.
Second, 1, 2...
Welcome back. If you're joining us for the first time, we have with us in studio Urologist Dr. Greggory Pinto. We're talking about a little of everything we do. I mean, child, he's loaded with information. But during our break, we were talking about prostate examinations, right? And what Dr. Pinto was explaining to us is, hey, there are advanced technology. There are ways that we can test a man's prostate without having to go through, right, the anal cavity, correct? And so men have this idea, assume that, hey, if I have to go and see the doctor or get a checkup, they have to go there. They have to look there. And it's very uncomfortable, obviously, for whatever reason. But there are ways that you can do it, right?
Correct. In the last at least 8 years, governing bodies, including the AUA, American Urology Association, have changed the protocol in terms of surveillance. I'm talking about surveillance. We're talking about a 40-year-old, a 42-year-old are coming for just their annual prostate cancer surveillance. There is no inherent benefit in doing a digital rectal exam. First of all, there's a big misconception that if you feel something abnormal on the digital rectal exam, that means prostate cancer. It doesn't necessarily mean anything. And what we're trying to do is pick up prostate cancer when the digital rectal exam feels completely normal. So there are men who have, first of all, we do an annual screening blood test, PSA, prostate specific antigen, every year from the age of 40. And it has to be every year because we're comparing one value from 1 year to the next. You can still have a value that is per se in the normal range. And that normal range is also age specific. So the normal for a 45-year-old is lower than that normal for a 65-year-old. But we're looking, it's very individualized. So someone's PSA might be a little bit higher than someone else's. So we're looking what was the value from 1 year to the next. Is there a very large increase from 1 year to the next? That in itself can be worrying, although it's not a very specific test. It can be elevated for incomplete bladder emptying. It can be because of inflammation. or infection of the prostate. It can be enlarged. It can be because of enlargement of the prostate, it can be slightly elevated. We have more specific blood tests. We have genetic testing. We have urine RNA tests. We have imaging that can pick up prostate cancer sometimes 5-8 years before the digital rectal exam. So I've had patients who said, oh, my GP did a digital rectal exam, said it's completely normal. That's meaningless. It doesn't mean you don't have prostate cancer. They'll say, oh, my PSA blood test is normal, I can't have prostate cancer. Again, that is not a given. You can still have prostate cancer and still have a normal PSA.
So can you repeat what is the most accurate test then?
So we start with, and it has to be every year, because you can have a normal value at 53 and then you don't have anything taken until you're 59. And then those ensuing 6 years, you can develop prostate cancer. So it has to be every year. If there's any abnormality, either it's in above the normal range, which is age specific, or there's a great increase over time, we need to determine why that may be. We can do more specific blood tests that can pinpoint whether there is a likelihood of cancer or not. We can do imaging that can give us a statistical probability whether we need to do further investigations, including a biopsy. But you don't have to have this worry that, oh my God, I got to have a digital rectal. That's the only way we can pick up prostate cancer. Absolutely rubbish. Absolutely rubbish. The vast majority of patients that I pick up prostate cancer, in fact, there's actually a treatment modality that's been around for 25 years, 28 years, called active surveillance. We have so many things in our armament to pick up prostate cancer that we can pick up prostate cancer when it's clinically insignificant. It's so early, so low volume, it's of clinical no significance to you. In many cases, we can repeat your blood tests every 3 months, repeat imaging once a year, and you can go 8, 10, 12 years before we need to cure your prostate cancer. You don't even necessarily need surgery to get cured of prostate cancer. There are many ways that we can cure you without even any invasive procedures. Even if you opt for surgery, it can be done minimally invasively. You could be up and about in 2 hours out of hospital the next morning.
That's amazing. I have a relative that told me that they had to take this jug to drink prior to the exam for prostate. I don't know if you know.
No, that would be for a colonoscopy.
That's a colonoscopy.
Yes.
Okay, sorry, that's completely different.
Yes.
All right, so they had a colonoscopy. Is that something that is required as well for men? Do you think that is something that
Yeah, in the last few years, the age of colonoscopies, it's been advised to start at the age of 45 at least once. And once you have a colonoscopy, in most circumstances, it's normal. You can wait another 8 years or so before you need to do another colonoscopy. So again, there's a high incidence of colon cancer in this country as well.
Wow.
So you have to look at any change in bowel habits, look at any family history that may make you more likely to get see even a gastroenterologist earlier than life than someone else. But always listen to your body.
So what is there like a procedure that can be done with colonoscopy that does not allow that?
So even then, there are specific blood tests that can actually pinpoint and create a subset of patients that actually really require a colonoscopy. There's even virtual colonoscopy where it's just basically a scan that basically it's not as sensitive or specific as the actual colonoscopy, but it does still give us will pick up a high number of colon cancers that otherwise would have progressed and advanced. So the first thing is always see a primary care physician, and that should be with the NHI program. You don't have to worry about finances, even as if you have insurance, it's covered by insurance. But always never skip it, because you'll feel fine. Your blood pressure could be 229 over 130, and that can be causing irreversible damage to every organ of your body. And for men, the first organ that's going to fail is your male member.
Yeah. So speaking of which, when they come to see you, what are the top 2 complaints that you normally get from men who come to see Dr. Pinto?
Erectile dysfunction and urinary symptoms, such as frequency, urgency, stop and start stream, waking up 8 times in the night to urinate. All of a sudden, they got to drive with a cup because they can't even pull over the side of the road to get to a tree to urinate. So the bladder is controlling their life and it's ruining their life. They're depressed because their erections aren't what they were once before. So that's also compounding their self-esteem issues as well. So those are the 2 main ones I would find. Or recurrent urinary tract infections. Men shouldn't be getting urinary tract infections. Right. It's quite common for women, but men shouldn't. So that's also an issue that, or even incontinence, men who have essentially are chronically obstructed by an enlarged prostate, which affects every man. Mm-hmm. By the time you're 50% of men are going to have an enlargement of their prostate, and I'm talking about benign disease, BPH, benign prostate hyperplasia, that's going to prevent them from having that good flow, emptying their bladder completely. And that's just going to cause havoc on the quality of their life. And it's not just an inconvenience. If you're waking up 6-8 times in the night to urinate, you're overflowing because you're not emptying your bladder. That can have irreversible damage to your bladder, back pressure on your kidneys that can lead to acute kidney injury. And I've seen too many men in this country. It leads to them having chronic renal failure. Yeah. So listen to your body. There's no need to be ashamed. I've heard it all. I'm not going to judge anyone. Yeah. The cornerstone of my practice is confidentiality. Yeah. You don't have to fly off to the US to get first-class quality urology care, even minimally invasive procedures. Everything is offered right here. If I see you in the food store, if you want to nod at me, I'll nod at you. But you don't know me, I don't know you. Yeah. Your business stays in the office. Yeah. Okay, yeah. So there's no need to be ashamed of what you're going through, because the tragedy is you continuing to live with embarrassment that you shouldn't have unnecessarily, and it's causing the problem to get worse, and it's just a mushrooming effect that's going to get out of control.
Mm-hmm. So how can we prevent issues like urinary tract infection and overactive bladders? How can they be prevented?
First of all, you need to, well, for women, obviously the reason for it will be different from for men. Right. If we're talking about for men
for today, yeah.
Well, you have to live healthy living. If you're obese, you're going to be predisposed to so many other issues. Mm-hmm. Let's talk about prostate cancer. Prostate cancer, obviously, any cancer you have, whether you're male or female, the healthier you are, the more likely you're going to survive. Mm-hmm. The earlier you're going to pick it up. So the key to survival for any cancer is early diagnosis. Yeah. That's the key. So obviously, how are we going to diagnose you early? You want to have annual surveillance to pick it up when it's early. Mm-hmm. Even when there are no symptoms, you want to be able to pick it up by doing tests to pick it up. Mm-hmm. Then you also want to obviously listen to your body. If there's anything wrong, don't be afraid to there's no embarrassing thing. Even if it's nothing, it's better to be overly cautious. Mm-hmm. Always be overly diligent than to be foolhardy and live with something for 3 years and it's caused irreversible damage when we could have got you straight three years before that, where before it affected your kidneys, mm-hmm. before it affected your heart. Mm-hmm. So stop self-medicating. Stop Googling. There are too many people who think that
Google. If you leave it up to Google, you'll be dead long time. Don't.
Yeah, exactly. Right. Exactly. Mm-hmm. So let persons who dedicate their life to specializing and going around the world and training in first world tertiary centers, academic centers, being exposed to every pathology, anything under the sun, and bring back the first technology and the first world methods of dealing with common conditions such as benign prostate hyperplasia, such as prostate cancer, such as overactive bladder, such as recurrent urinary tract infection. So because you have a urinary tract infection, just taking antibiotic is the worst thing you're going to do, because you want to why are you getting a urinary tract infection, particularly for a male? Right. You need to determine it. Is it related to incomplete bladder emptying? Why are you having incomplete bladder emptying? Mm-hmm. Are you a diabetic? Are you having something called diabetic cystopathy, where uncontrolled diabetes is unknowingly destroying your nerve supply that allow you to empty your bladder, affecting your bladder filling sensation? Is it because of hypertension also affecting the blood supply and nerve supply to your bladder? Is it because you have a physical obstruction in terms of an enlarged prostate? Is it because you have a urethral stricture where for many reasons you might have developed a scarring within your actual urethra and also prevent you from emptying your bladder? So always listen to your body. If there's something going wrong, address it immediately. Don't wait.
Right away. Let's talk a little bit about the mental part, the psyche of a man, right? Is there such a thing as midlife crisis? Does that really exist? Let me hear your views, because I asked this question to Dr. Joseph Evans last year. Let me see if you all both have the same opinion on this.
Of course. I mean, there's so many facets to that question. But essentially, men, as they get older, they're going to look at their life. They're going to look at what have they achieved, what have they not achieved, what is in store for them for the future. They may not be happy at the particular station that they are in life, and that in itself can cause them to be depressed and anxious. And obviously, there are issues with family. We want to be able to support your kids, give your kids the best, support your wife. Support your extended family. You want to professionally achieve your goals that you had when you were younger. Sometimes life is unpredictable and things don't happen like they should. But always there are stories throughout history where men never became successful until they're in their 60s or early 70s. So there's never time to say, you know what, my life isn't where I'd like it to be, and I'm going to give up. Always strive for excellence. You could always turn things around. Many very successful businessmen have failed multiple times, and they've learned from that, so that they become the success that they are right now. So even in failure, there's a lot to learn, and you can use that to motivate yourself as well. But yes, as a man gets older, you're gonna have many things that you're gonna look at in life and want to know that, you know what, this is not where you would like it to be. But you could always change and strive for greater things in the future.
At what age do they normally develop this midlife crisis? Dr. Evans didn't say what you said, by the way. One of these days I'll bring it to you all there so y'all can tag team. But at what age?
Well, they always say middle age, so that can be late 40s, early 50s. That men are looking at what have they achieved. They've already reach the milestone of half of their life on this earth, and they want to know, what have I gotten so far? What do I want to get with the rest of my life? Am I happy with what I've achieved? And then you also have to look at, if you want to have more years on this life, the first thing you need is healthy living. You want to have a balanced diet. You want to have exercise in your life 3 times a week. If you don't like swimming, don't swim. If you don't like going to the gym, don't go to the gym. If you like volleyball, play volleyball. Do it in groups where you have persons to encourage. You're not going to always feel like getting up 5 a.m. to go walk, even if that's something you like to do. But if you like to do it and you have people around you who care about you, who are going to motivate you to do it, then you're going to more be likely to stick with it. So get some kind of exercise and listen to your body, as I said. And that can make you feel more energetic. That can make you feel sleep better, be more vivacious. That can relieve stress and anxiety and make you less likely to be depressed. It's a great stress reliever, just exercising as well. That can also give you structure in your life where you can develop friendships and camaraderie and everything else. So the benefits are multiple.
And is it so that every man goes through this? Because I don't recall if you said that or not. Or you just, is it something?
I think it's more common than not. I think it's more common, and obviously every man's gonna face it to a different degree than others. I mean, some men feel more sense of achievement at a certain age than others. Obviously, no one's gonna always be satisfied. They always want to go for higher heights and greater levels of success. But it might be as simple as you might be disappointed in one of your children and what they've achieved. So don't give up on that child. Obviously, there's, as long as you have life, there's always way to get things back on track. So not everything in life is straightforward, but if you are throwing curveballs, whether it's monetarily, financially, professionally, socially, medically, you could always rebound and use that to motivate you for greater things. If you didn't listen to your body and you developed diabetes and you're on dialysis, don't live in depression. Speak to your church members. Don't let that happen to them. Speak to the men in your family. Don't let them do that. So even if you've had some form of even medical tragedy in your life, make sure that at least someone can benefit from that. Create awareness within the community, within your family, and your friends.
So let's help the women who are tuning in now with men who may be going through midlife crisis. How do we as women, how do we identify that in our men, and what are some ways that we could help?
Well, I think the COVID-19 pandemic, which is not over, but that created a lot of financial stress on men in particular. Men who all of a sudden were out of work. They couldn't pay for school fees. They couldn't make their car payments, their mortgages. They couldn't pay for rent. They have to go and live with extended families. Grown men taking their families to go live with their parents. So it took them swallow a lot of their dignity to go through that. But as a worldwide body, everybody went through it to some degree. Now we're all rebounding. I think that use that to motivate you, that you may have been out of work for 18 months, but now that you have work, be the best that you can be. You may not be what you wanted to be. Maybe you're a great landscaper. You can want better for your children. So you instill the importance of education in your children and make sure that they have a better life than you. That's what every parent wants. That's what every father wants. That's what every husband, to have a better life than you had as a child, and make sure that your wife has a better life than she had and then her parents had. So let's just academically and every other way, let's improve one generation to the next.
Yeah, I love that. So how do we tell? How do women?
Oh, well, we have to speak out. If you see that your husband or your boyfriend or your grandfather is withdrawn, he's having sleep disturbances, he's trying to self-medicate by smoking cigars or alcohol, you need to speak to them. I mean, you need to address the issue. There's no need to allow them to suffer in silence when you love them. You make sure that they know that there is help out there. They're wonderful psychologists, psychiatrists, counselors that are readily available, even through the public health system, that can help you. And there are groups in terms of stopping smoking. That's a terrible addiction. Alcohol addiction. There's also groups that can help you. Just in terms of depression, speaking through your problems. If you need to be on medication, short-term or long-term, there's no shame in that. The shame is that you're too depressed to get out of bed, that you have suicidal ideations, that to get through the day, you have to have 8 beers every night, that you're withdrawn from society, that you're withdrawn from your family, that you're irritable, you're physically abusive because you're taking that tension out on your family members. Stop doing it. There's no harm in looking for help.
Okay. Yeah, so go and find help. In other words, you can't do this on your own. You have to have someone to be able to assist you. Someone
within the family, there's support. Within the community, there's support.
So I'm going to ask you 2 personal questions. So if you don't want to answer them, it's okay. The first personal question is, have you? I mean, I don't know. You don't have to tell me your age, but did you ever go through that midlife crisis phase?
I think I was fortunate in that I achieved the goals that I set out for myself. In fact, I've probably far exceeded which I set out, and I always had lofty goals. My parents always instilled education as primary importance in our life, God in our life, family in our life, family first, taking care of family, extended family, cousins, being there for grandparents, being there for your parents as you get older. But education was primary. I mean, you do your homework, you try to be the best in the class. You try to have the greatest aspirations. My sister got a degree from Harvard in economics. She graduated first of her class in Yale Law. My brother's a gastroenterologist in the States. Awesome. With a fellowship. So, and many of my cousins as well. Whether they're engineers, they're specialists, dentists, whether they're lawyers. My wife is a lawyer. So that in itself, you always want to be successful in every facet of your life. I far exceeded myself, I think, professionally, even in terms of the wife I got. I outdid myself.
All right. So you didn't go through that.
I have not gone through that, unfortunately.
Okay, so it is possible for men not to go through it. Not every man has to go through that phase.
Correct.
So what's the difference now? Okay, no, let me ask the next personal question. Really personal. But have you have experienced men coming to you, even though you're dealing with them physically, that you had to end up counseling them in a way? So you're dealing with them mentally. Were you ever in that situation? Do you go
that's
through that?
That's an everyday occurrence. Yeah. So men dealing with erectile dysfunction,
counseling them and speaking to them.
Men are dealing with erectile dysfunction for many years. Obviously, you want to let them know that I always have this mantra: you can always rise again. So there's always hope. No matter what, you could always, if
pun
you,
intended.
yeah,
Okay.
rise again from the ashes like a phoenix.
Mhm.
No matter what, there are 4 levels of treatment for erectile dysfunction. First of all, as I said, you always want to treat the root cause.
Right.
But let's say you had diabetes for 10 years, you admit you didn't take your medication, it's caused untold harm to your nerves and your blood supply to your male member. The things we can do to get you to have a wonderful erection. We can do a penile implant, which is a minimally invasive procedure where even a new partner wouldn't actually feel that you have that. I've written and spoken about it many times. In fact, I do medical tourism for it. The bionic penis. You can actually.
Hold on. What?
Yes.
What? Hold on. That's a. Hold on. Beats. I light right up. Did you see that? Beats I going from here to what is it? What is it? Beats. Go see him tomorrow.
They call it the quote unquote bionic penis. It's a penile implant that's placed minimally invasive. And there's not one single stitch or scar to your male member itself. And it's a 3-chamber device, very advanced device. It's not battery operated. You wouldn't even feel that you have these implants inside. Basically, you just press a little button that you feel in your scrotum a couple times, and you can be erect for as long as you want, 20% longer than you've ever been.
So you trying to kill that woman?
I know.
What you trying to do, sir?
That's not good news.
That can't be good. Well, your wife. Well,
Yeah.
she's
No,
the
but
lawyer.
So this can change men's life. So
No, but
let's
is
say
that
that's the worst case scenario.
No, but I mean, can I ask you a question? Do we have any Bahamians that have already used this? You ain't got it.
Very much so, yes. In
Really?
fact, I had, when I first started doing it many years ago, there was a reverend who was
Yeah.
in fact, it was a NASA guardian that actually
too
was
much,
interviewed.
Mhm.
Obviously,
About that?
it was anonymously, but
Ooh.
he spoke about how it impacted his life, his marital life, and his outlook in life, and
That's
everything
why
else.
the sermon was so good.
Exactly.
Ooh, child.
Exactly. So as I say, without
I'm only kidding,
exaggeration, you
everyone.
can always rise again.
Yeah.
And bigger and better and longer than ever before
Ooh.
for as long as you want. So I'm not trying to promote. I'm
I
not
don't
trying to
we
promote.
don't like the long as you want
All right.
part. Okay, go ahead.
I'm not trying to promote sweethearting
I
as you get
understand.
older,
No,
but
no,
you
no.
could always rise again. You can always rise again.
Rise from the ashes.
You have the same sensation. You can still have children. You can have the same orgasm.
Yeah.
And if you want to be up for 6 hours, you can be up for 6 hours.
So there's a button that you press on your scrotum. So you gotta go
Correct.
feel that. You gotta look for it. Like,
No. You know where it is, and you can feel it. Only you can feel it. You press it a couple times, it goes up. You press it once, it goes down.
I can't.
As simple as that.
I can't get the image.
No,
of
but
those.
sorry, go ahead.
You remember the Nike Air Pump shoes?
Yes, the pump
I
shoes.
just can't get
Very
that
much
image
so.
out of my head.
Very
It's
much
like,
so. So I'll put it
let's
even
go.
further. In my training, one of my professors who trained me did the world's first penile transplant. So I always will tell my patients, and I'll tell the community, if you can go from having no male member to not only that patient had a very active sexual life and got his wife pregnant.
Oh.
If you can go from no male member to getting someone pregnant and having erections anytime you want, no one should give up hope.
Oh my goodness. Wow. All right. So for the ones who don't want a bionic penis, right?
There are other things that can be
There are-
done. First, as I said, you treat the root cause. There's no
Right.
point giving you medication to get you an erection and then uncontrolled diabetes or atherosclerosis or some form of cardiovascular disease is progressively getting worse. Even that medication will give you will stop working.
Let's talk about those, like you use the term, these gas station pills that people tend to go
So
get. And the
they're not
dangers of those.
they're not FDA approved.
We're gonna take a break.
Okay.
Okay, let's take a break real quick because this getting juicy. Right, Dr. Pinto, I didn't know you had it in you. All right, so we're gonna wait, y'all, and we're gonna get back after this break.
The sun is shining out on your face.
To my Facebook audience, thank you so much for tuning in. If you have any questions, you can go ahead and post it. If you want to be discreet today, you can go ahead and WhatsApp the number 376-8689, 376-8689, where I will ask your question discreetly.
I have a question.
Mhm.
I wanted to know about thyroid problems in men,
Mm-hmm.
and how does it affect their sperm count and fertility, etc.?
I mean, that's one of the things we rule out. So if someone has male infertility, which is relatively common, the first thing we're going to look at is testosterone level. We're going to rule out something called varicocele, which is a distension of the testicular vein, and we're going to check their thyroid function as well, because that can negatively impact not only their erections, can explain unwanted weight gain, but it can affect their ability to conceive as well, to have normal sperm numbers.
So someone who has had their thyroid, they take that pill to kill the thyroid, and then they're on medication for the rest of their lives, pretty much.
Yes.
Someone that has been through that procedure would be negatively affected as relates to.
Not necessarily. So if you're on medication, it's supposed to have your thyroid levels at a normal level. So it shouldn't be impactful. If you don't take the medication, yes. Yes.
This is really good. All right. So somebody asked real quick, I guess, since we're on a break, why urinary infection in women?
It's an anatomical reason, because women have a very short urethra. So bacteria can easily go into the bladder, and then it enters the urogenital system. And also anatomically, women, their anus is very close to their vagina. So even in sexual intercourse, it's easy to get bacteria, even inherent normal bacteria or flora from your gut into your vagina.
And it's also important to the way that we wipe.
The way you wipe, using douches too much, having
even holding too many urine too much, right?
No.
That can't do anything?
No.
You sure?
Yeah.
Look at me asking him, right? If he's sure, right?
Yeah.
I thought holding in urine causes UTI.
Not necessarily. If it's an issue where you're not emptying your bladder, yes. So you go to empty and you feel like you've emptied and you're still having half full bladder.
Eventually you'll get
bacteria.
UTI.
Yeah, eventually.
Okay,
but it's not only that. A lot of women you need to get a urine culture to determine which antibiotic you should be on, because there's a lot of resistance in the community for a lot of urinary tract infections. So you may be on an antibiotic, you may take it religiously, but it may mean that the bacteria that you have is resistant to that antibiotic. So basically, you're wasting your time.
Welcome back. If you're joining us, we have with us Dr. Greggory Pinto, a urologist in studio. And just before our break, we actually had a question during our break from Odessa. She spoke about thyroid and what would be the cause of the issue as far as infertility is concerned with our men. Dr. Pinto, if you want to, for those who are listening via radio and cable, you can perhaps answer the question again, please.
Okay, so male infertility is a very devastating and frustrating issue for a lot of men. A lot of people take it for granted that you can just have a child, but for a lot of loving couples, it can be difficult because of one issue or the other. So there's so many things that can impact a man's fertility. Obviously, his health can also negatively impact it. But even looking at slowly coming out of the COVID-19 pandemic, a virus can affect your testosterone production and your sperm production, and that includes COVID. So there are a lot of men who even had almost asymptomatic or mild symptoms of COVID-19, and their testosterone levels are going to be at a low level for even 3 months, 4 months, 8, 9 months after they've recovered. In the same period of time, the COVID-19 virus can also invade their testicles, and it also can affect their sperm production. Mumps is also a virus that notoriously can affect sperm production. So it's not just sperm numbers. There are other parameters that you look at in terms of male infertility, including such as the pH of your sperm, the agglutination, in terms of motility, in terms of morphology. You can never diagnose male infertility just on one reading as well. You have to repeat a reading at least and have an abnormal reading 2 or 3 times with intervening 10 weeks to 3 months between each sperm analysis. And ideally, even with sperm analysis, to get the accurate reading, you have to have not ejaculated for 3 days before doing the actual sperm analysis. So it's a complex issue that affects many couples, and it's no reason to go through that, particularly with technology including in vitro fertilization,
Yeah.
including ICSI, which is intracytoplasmic spermatic injection. It's really, if with that technology, male infertility is not really a limiting factor. It's more important in terms of the female, in terms of their uterus and their
Right.
ability to carry a child those 9 months. Then, if you, instead of having 300 million sperm per ejaculate, you have 300,
Mhm.
you can still,
Of
through
course.
IVF, have children.
Mhm.
In fact, with IVF, your chance of having twins is about 40-45% per try. If you have no motility, your sperm don't move at all, you can do ICIS, intracytoplasmic spermatic injection, where you can inject the sperm directly into the embryo, into the egg, and then you can implant it with IVF, and it's not an issue. So
Right.
obviously we have to treat every individual as an individual. Varicocele, which is a dissension of your testicular vein, is one of the most common causes of male infertility. It basically changes the environment of the testicle that affects sperm production. And it's similar in terms of physiological reason why you get varicose veins in your leg, where
Mhm.
the valves that allow the blood to return to the heart against gravity are incompetent. So you basically have a sludging of blood in your veins that leads to abnormality in the environment of the testicle, that leads to abnormal sperm production. And as many as 1 in 9,
Yeah.
1 in 12 men, even younger men, have varicocele.
So since we're talking about conception, trying to conceive, etc., what are some
So you only define infertility if you've been trying for more than a year,
more than a year?
with unprotected sex. Obviously, you have to be mindful that even as a couple, you can only really get pregnant 5 or 6 days out of the month. And that's why using ovulation kits are
Ovulation,
very
yes.
important to know which of those 5 or 6 days. Even if everything is perfect, let's say a 20-year-old male, a 20-year-old female,
Yeah.
perfect health, every parameter is perfect. Statistically, you only have a 15% chance of getting pregnant every month. So the average couple may take a year, just over a year, to get pregnant.
Mhm.
But if it goes into a year and a half, then we want to look at male factors, female factors, or maybe both.
Yeah. And is there a way to help with men's health regarding when they're in that phase of wanting or trying to conceive? For instance, I've heard you can't wear too much tidy whities. I don't know if that's a factor.
I mean, that's
Okay.
not a major issue. You want to stop
No.
smoking, and that includes marijuana. A lot of men don't want to hear that. You shouldn't be smoking nicotine products anyway.
Mhm.
You want to make sure that you have a normal body habitus, you're getting exercise, healthy diet, etc.
Mhm.
But first thing you need to do is to have a urologist figure out exactly what may be going on. And as I said, a varicocele is something that I can minimally invasively repair in 15, 20 minutes. And I've had dozens and dozens of men in the society who tried 5, 8 years to conceive, and we fix a varicocele, and their wife or girlfriend or partner is pregnant in the next 4 months, 5 months.
So what about those who perhaps just got married? They want to know, how do I maintain my health? So when it's time for us to actually conceive, we would know what to do. For instance, is this a fact or myth that men shouldn't be in like hot water, like steaming jazz tubs, or
It can
hot
some.
tubs?
I mean, there are numerous studies. Some that will say one thing, some will say other. But across the board, it may affect your sperm production in that intervening 3 months or whatever you might have been exposed to, whatever. But in terms of statistically, is it really going to impact your male fertility? No.
No. Any other myths
So in
that
terms
you
of
may have heard?
don't ride a bicycle,
Yeah.
don't wear tight
Tidy
on.
whities.
No, that's not.
No.
That's live a healthy living, get regular exercise, have a normal body habitus, make sure that you're aware of the whole reproductive issues with ovulation and timing it. That's extremely important.
Mhm.
There's too many misconceptions out there. You can get pregnant 30 days out of the month, when obviously that's not the case.
Mhm. Let's go back to men's health. Let's go back, to men's mental. Oh, sorry, go ahead.
Well, I had 2 questions.
Two
One
questions.
is coming from the listeners.
Uh-huh.
I have a question from Miss Yolanda Edwards. Well, 2 actually. The first one: do you see female patients? I'll go ahead and answer it. Yes, he does. And the second question, she is wondering is there, as there is the bionic penis, as you mentioned, is there a bionic vagina?
That's in the question. How come I did that? That's in there? Oh, I didn't. Pull that up. Let me see.
It's
No,
on
I
the
can't
screen.
see. You see it? I can't see it either.
So
Go ahead.
there is a
But that's-
topic.
that's a
There
very good
there is
question.
there is a subject of female dysfunction,
Mm.
where it can be for many reasons. It could be a hormonal issue. It could be related to your thyroid. It could be related to estrogen levels. Women have testosterone as well. So yes, a urologist can help with that as well. It could be related to dyspareunia, where women are actually having painful intercourse, and obviously that can negatively impact things as well. And that could be many reasons, and particularly as you enter menopause, you're going to have a lack of lubrication. You can have vaginal atrophy. We can look at that as well. There's even the issue under urology. There's also the topic of subject of vaginal rejuvenation, where we could actually, and I was trained to do that as well. I don't commonly do it, but I have the skill to do it. We can actually, as a woman has gone through whatever, had
Tighten.
6 kids. Yes.
Yeah.
Yes. It's
The best way to
as
put
the
it.
word says it.
Yeah.
Yes.
Yeah.
So that falls under the purview.
Look at me.
That falls under the purview of a urologist as well.
Yeah. Yeah, I want you to be as transparent. You're doing a good job. You're really doing a good job. I mean, I appreciate you so much because you have some men. Sorry, I haven't saying men because he's saying that. You have some professionals that come on my show that are very uptight and they're afraid to say certain words, and you just out the door. You just out the gate. I love that. And this is the reason why we have our listeners, our listening audience come and listen to this particular show, because they know that certain places where they won't be able to hear blunt, real information. And so I'm grateful for you for that. Pete, you had another question? You good? Because I was going on to another question.
No,
All right, so we're going to go back. Okay, that's cool. We're going to go back to mental state. How can you tell when a man, because we already spoke about the midlife crisis. Okay, fine. But I'm certain that there's a thin line between a man with midlife crisis and a man that is in a state of depression. So what are some of the symptoms of a man that may be depressed?
Well, I'll even tie it into what I discussed earlier, low testosterone. There's a very strong correlation between depression and low testosterone. And as I mentioned, in keeping with the male version of menopause, so that can cause depression, irritability, it can cause sleep disturbances, it can cause anxiety. That can be tied in with even medical issues. If you're gaining 40 pounds, you don't even recognize the man in the mirror, that can itself cause depression. If you're only managing to sleep 4 hours a night and you're sleep deprived, that in itself, whether it's because you have obstructive sleep apnea and you're not getting that proper REM sleep, rapid eye movement, quality sleep, it might be because you're waking up 6 times in the night to urinate. It's causing strife with your partner, your wife, because you're waking her up 6 times in the night, and both of you going through life like a zombie because you're never getting that in itself can be depressing itself. So there's so many ways that a man can feel depressed. It might not just be one thing, and in many cases it's not one thing. So obviously you need to get to know your patients. You need to have a good rapport with them. It has to be open dialogue. You have to make them aware that it's a safe environment to discuss any issue, and that as a physician, as a urologist, I'm a vault. If you want to talk about any aspect of your life, it stays with me. So you need to be able to have that relationship with your patients, and the patients have to be comfortable with you, but there's no reason to suffer needlessly.
Right.
And if you're feeling hopeless all the time, if you're struggling to even go to work, if you feel like you don't want to do anything you once used to love to do, if you basically become a social shut-in, you don't want to go out anymore, that you may not even recognize it, because sometimes it's a slow progressive change, but there might be something going on. It might be as simple as I said, low testosterone. It might be a body image issue where you're putting on weight. There have been many studies that have shown that someone who has low testosterone, and we can pinpoint why you have the low testosterone, we can correct it. The average person was losing 50, 60, 70 pounds. That's life changing. That'll turn their life from darkness to light. So don't just look at it as, oh, he's lazy, he doesn't want to go and work out, because maybe he doesn't have the endurance to work out. He might eat as healthy as he can, and he just can't put off the weight because of the low testosterone. He might feel fatigued all the time because he has sleep apnea. So there's so many things. It's a very complex issue, but it's no one answer for
I get it.
everybody's an individual.
So even even as you're saying this, some of the things like the lack of sleep doesn't feel as motivated or demotivated to want to go and exercise, putting on weight, and all these other things. So what other thing can we as women identify? How do we know that our husband is going through something ain't right? We know something isn't right, but how can we tell that this is an issue, that he's probably depressed or he's going through something? Go ahead.
Well, you
Symptoms.
as
You know your husband.
you know your husband.
Yeah.
You can recognize unhappiness before he'll be able to, because a lot of men will live in denial.
Mhm.
It might even be your mother. It might be your grandmother. It might be a child who would recognize that you're more irritable, that you don't want to do anything anymore, that you're at work, you're not happy to go to work anymore. You're not satisfied with anything. You don't want to go on vacation. You don't want to watch NBA finals anymore because you're just not interested. You don't want to go out with the boys to play dominoes. So you can see a change. They might not be able to see the change. For a lot of men, even physically, and a lot of issues like waking up to pee all night, that becomes their normal. They don't know anything other than that because they've been experiencing that for 10 years. You have to remind them that it doesn't have to be that way. It's not an inevitable part of getting older.
Right.
As a woman, you don't have to be wearing a panty shield because you laughing and peeing yourself, or you're lifting up your grandchild and you're wetting yourself, or you got to know where the next bathroom is. You strategically have to plan your life. Where's the next bathroom? I'm not going to drink a glass of water until I get home.
Yeah.
You don't have to live like that. You don't have the bladder control your life and rob you of your happiness.
Wow. Let's go with nutrition now. Adasa, we're going to talk about, is there a special diet specifically for men, that they should follow the older they get?
Well, obviously you have to pinpoint whether you have silent comorbidities such as hypertension and diabetes or high cholesterol, and you're going to cater your diet based on those diagnoses that will tell you, all right, you're not supposed to be eating too much of that. So for most things, it's not like if you're a diabetic, you can't have a piece of cake once in a while, or you can't have a fast food now and then. It's just that you don't want that to be the staple of your diet. Red meat every day, adding salt to your meals every day, potato salad, macaroni every day. Everything is in moderation. So obviously, if it means you're going to see a dietitian, if you want advice from a physician, they can guide you. But stop. If you know something's wrong, that you're not happy with your body, don't live like that. You can rapidly change. As I said, I've seen people lose 80 pounds in 6 months because we've addressed their sleep apnea, their low testosterone. We've gotten their diabetes under control, and they have a new outlook on life. They feel 20 years younger. They feel more energetic. They feel a new lease on life. So it's never too late, even if you've been suffering and for many years and feeling down in the doldrums, you can always rebound. And there's always something that can be done.
So is there like special foods, for instance? Is that a question? I can't see it. Put it back up for me. I can't see that. Would you recommend surgery for, I can't pronounce this word, hydrocele? Is that how you pronounce it? In a male that is 93 years old? Is that how you pronounce the word?
Yes. So in urology, modern urology is minimally invasive. A hydrocele is just accumulation of fluid around the testicle itself. So every testicle has a protective lining called tissue called the tunica vaginalis. The tunica vaginalis produces fluid that basically has a cushioning effect for your testicle, protect your testicle. So it produces fluid and it reabsorbs that fluid. As you get older, it's not that you're producing more fluid, that the reabsorption rate by that lining, protective lining, seems to slow. So the cumulative effect is that you have more fluid. And a lot of men experience it. It's a very common issue where men literally feel, and I'll be blunt, feel like their balls are falling down to their knees. It's not that their testicles are getting large. It's the fluid around the testicle. It's a hydrocele. In these cases, you also have to rule out whether it might be an issue with a inguinal scrotal hernia. You could also have a swelling down there, which is actually part of your bowel contents, your omentum, or your actual bowel that goes into your scrotum as well. But if it's for it, can be done minimally invasively in 15 minutes at any age. So even for any procedure, even if you're removing a fingernail, you need to make sure that you medically optimize for whatever anesthesia, whether it's local, spinal, or general anesthesia, or even a regional block. And that is where we make sure that you are seen by anesthesiologists and make sure that you are primed for any procedure that we do.
Mm-hmm. There were a few friends of mine that joke about their husbands being using the restroom for long periods of time. Mm-hmm. I don't know if this is a man thing that y'all spend like an hour or so just on, look at, yeah, it is. I see. Yeah. So can you tell me some of the side effects or issues that may occur when they spend long periods of time in the restroom?
Okay, so there are two things we're looking at.
Meaning the toilet.
Yeah. Okay, so when we're talking about loss, first of all, we'll talk about urination. It's very common you go to a restaurant and you're in a public restroom and you're there struggling with urinary hesitancy to even start the stream. Mm-hmm. And then when it comes, it's slow, it's stop, and it will start. And then you see a young man come a few minutes later, in and out.
Poor.
Yeah. Mm-hmm. So you know that something is wrong. And simply we can give you medication that can have you peeing like a young man again at any age. If that medication, in most cases, it works very effectively. If that starts to stop being effective as you get older, because your prostate will continue to get larger, we can do minimally invasive procedures, and there are many of them that are readily available as an outpatient without a single cut, stitch, or recovery. And you can do it in 40 minutes and be home, and you can be peeing like a champion again and hitting the wall.
Like a champion.
Yeah. So you can be 88 and you can be peeing like an 18-year-old.
What if when they're just sitting on the toilet?
And then even for passing stool, you always have to look at change in bowel habits. If you're struggling with constipation, there are many reasons for that. It could be dietary. It can be related to many things, inertia of the bowel. But you want to make sure that there's nothing sinister going on. Right. Particularly the older you are, you're going to be more mindful for that. So men at any age need to look at for change in bowel habits and go see a physician, and they can intervene as necessary and do whatever investigations to determine if there's anything of any concern going on.
So it's not beats.
So all of a sudden you're not passing stool every day. You're passing stool. Now you're doing it every 5 days, and you're feeling bloated and abdominal distension and discomfort and everything else. You need to address that. Just don't live in ignorance.
Right. And what if it's just for pastime? Like they're just sitting on the toilet, just scrolling through their phone, just taking it out.
Well, as we talked about stress and relief and everything else, many men find peace where away from all the hectic hustle and bustle in that place. Let them have it.
No, listen, if I touch a subject or a topic that's a little touchy, I want you to look at our producer. It's so funny. Like no, but seriously, the pastime, they just scroll through, they check emails.
Well, I mean, that might be their quiet time, their domain. They're away from the hustle and bustle of life. Let them have it. But if we're talking about difficulty emptying the bladder, if we're talking about emptying their bowels, then that's another issue.
Constipation, that's an issue.
Or inability to empty the bladder or have a good urinary stream. That's an issue.
When you sit on the toilet too long, you get
well, that's the least of their worries. If that is a stress release for them, if that's their quiet time from the 6 other kids in the household,
give them what they
give
want.
them that time.
That's a small thing to pay, right? Go on, Beats. Go ahead.
First, I'd just like to say that we always appreciate the input from Dr. Pinto, but as a double board certified male, I just would like to provide some insight on this topic of men prolonged bathroom use. And to the women out there listening, like Dr. Pinto said, it is a very relieving time that can be quite beneficial to the mental state of the man. Also, the bathroom time offers opportunity for reflection.
Right. It's like a sanctuary.
Understanding. And honestly, you want to take in all that goes on at that time, the scents, the sounds, the sights. That's a time that a man may take to inspect what's going on with the different parts of his body.
Okay.
You need that time.
So
to the women out there that are on the door, and you went out. ease up.
Ease up.
Leave us.
Leave y'all.
All right. You be coming out eventually.
Yeah, eventually.
Eventually.
An
Now,
hour.
if it's been an hour and a half, then okay, you got me. But
At least an hour.
At
yeah.
least, no. Honestly, Dr. Pinto, for every woman that I've heard tell this, they say when they speak about this, their husbands have been on the toilet or in the bathroom for at least an hour and a half.
Well, that might be their place of
That's their
solitude. Yes,
yeah,
and
go
privacy.
ahead. Do what you gotta do. Do what you gotta do, sir. Go and take it hour and a half, whatever you need, sir. We do apologize. All right. So we spoke about nutrition. We have a question. Go ahead. Read it because I can't see it. I'm usually the last to see these questions.
What role does diabetic neuropathy play in all of them?
Yeah, so that's an advanced impairment from uncontrolled diabetes, and even for patients who have chronic diabetes, you can have some element of nerve impairment, even relating to erectile dysfunction in terms of related to constipation, emptying their bowel. You can have diabetes affecting their bowels. It can affect their bladder. It can affect their erections. So when you have issues where you're having neuropathic pain or neuropathic ulcers, that's just one sign of prolonged uncontrolled diabetes. So all of a sudden, that's why many diabetics, particularly those who are not well controlled, they have to inspect their feet because many times they'll have injuries that have become infected, and because of paresthesia, they have no feeling there. They're not aware of it. They have to make sure that when they go into a hot bath, a scalding hot bath, they may put their foot in first and not feel it. So always be getting your annual physicals at any age is important, because diabetes can be even have a negative impact, greater impact in terms of even prostate cancer. Prostate cancer we can treat, and that's it. And your survival is almost guaranteed if it's early disease. But diabetes is something that you gotta fight your entire life.
Yeah. So, where did we stop? Did we talk about mental? Yes, we did. So, work stress. How does that impact a man? Everything, the physical, the mental, sexual. What can you tell those, especially with men who are listening, how to deal with work issues, and how to organize themselves accordingly?
Well, I mean, it all depends on the individual as well. I mean, everybody has their support network. Everyone has their way of dealing with issues. Some persons, such as police officers who I see every day, all day, are on the front line, and they're seeing the worst of humanity. They're on murder scenes every other day. They're dealing with the worst criminals imaginable. And they're frustrated with the court systems and the revolving door of the criminal justice system. And many of them are just burnt out, and they have no relief for that. Many of them have superiors that they find to be unapproachable, or they feel are abusive. So there has to be some outlet, and depends obviously on the profession. There may be actual counselors that are provided to give you relief, where if you've involved in a shooting or you've seen on a gruesome murder scene, that you can get specific counseling for that. But every man is going to have some amount of stress, even as a surgeon. It just depends on your personality. If some people, not everybody can be a surgeon. You can't deal with seeing death all the time and cancer and being called in at the spur of the moment because of gunshot of women, children, and everything else. For some people, they can take that, but for some people, they just can't deal with that stress. So sometimes the profession is the wrong profession for you, because you just are not equipped emotionally, and your personality is not attuned for that. Maybe that you can't deal with that side, a negative aspect of life, and you internalize it, and it's just not for you. Sometimes you just need to change your profession.
That's amazing. And Dr. Pinto, it's the fact that you spoke about police officers. I have a special place in my heart for law enforcement officers, for whatever personal reason, right? And it's amazing that you said you have a lot of officers that come to see you, That's amazing.
I mean, even Defense Force officers,
Yeah,
they
law
go through a
enforcement
lot.
officers, yes, they
Nurses
see a
have a
lot.
lot of stress.
Yes,
So it's
that's
something.
amazing.
Even teachers, they go through a lot. It
That's
can be very
amazing.
frustrating trying to teach 35 students
Come on.
with different personalities.
Different
You might have
personalities.
overactive students in the class. It's frustrating.
So as women, how do we deal, or how can we help men in situations where, you know, they're overloaded, and they feel overwhelmed by their work stress and
I think
workload?
that you just need to even reach out to colleagues. You need to reach out to friends of your husband or your boyfriend, and as a collective, persons who care about you, try and provide support. I mean, there's so many ways that can be provided, but you just have to. Someone has to know that there is support out there. That they're not the only one going through it. There is usually a light at the end of the tunnel. It's not. It's going to go on forever.
Right.
You may feel like you're in rough waters and seas at this moment, but there is calmer waters and down the road.
There's
So
hope.
yeah, there is always hope.
There's
Yeah.
hope. There are professionals out there that can help
Exactly.
you.
Exactly. And then even within your own family, you may have an older relative who's been through the same thing and come out on the other side.
Yeah.
So it's important to speak to them as well.
Yeah.
So your experiences are very rarely unique. Other people have gone through it even worse than you. So to hear what they've gone through, even the mistakes they've made, you can learn from that. And then even the triumphs that they had in overcoming their difficulties, you can get solace and advice from that as well.
Mhm.
So I think we have to have a network within our community and
Mhm.
stop having this family dealing with this in silence
Mhm.
when we're all in the same church, for example, or we're all in the same this group or that group, with family members with this group of cousins dealing with one thing and not talking about the other cousins.
Right.
We need to all break down those and have open dialogue. Yes.
I love that open dialogue. Because that's the culture that men, and you notice, we, especially with men hold things and keep things to themselves. They want to be discreet. They want to be, private. Or, I don't know if that is due to pride. I don't know if it's due to the fact that their fathers tell them, listen here, boy, get it together. Keep your emotions, keep yourself, nobody needs to see you cry. Nobody. So sharing their emotions for some men is an issue. So even when they go through issues where they feel as if it's personal, they can't even share it with other people. And then I don't know if this may be a factor of it, because this is where now the depression starts to creep in a little bit more, because you feel as if you're the only one going through it.
Yes.
And you feel as if there's nobody else that can help you. You feel as if that there's nothing that can be done, and then you find yourself being more withdrawn, and almost to the point where you damaging your family because you can't get it together, because you don't want to go and talk to somebody to help you.
Correct. I think a big issue in this society for men, it starts even at a younger age, where as a society, we don't encourage academics. We don't instill the importance of education. So it's even males are criticized and berated and looked down upon if they're successful academically.
Yeah.
We're going to have to work hard at some point in our life. It's better to work hard in academics, succeed in terms of professional credentials and qualifications and experience. So your life is actually easier. You're able to have the tools to provide a better life for your offspring, for your family, for your parents. But it's too much in terms of it's the females that are dominating in terms of academics and success in this country, and that is negatively impacting the future of our society. I think we need to instill that academics are something that we need to have instilled in our male children from an early age, and they need to be lauded for their accomplishments, not to be criticized. And I think that's a terrible turn of events in the last few generations, where men are actually not encouraged to excel academically and professionally and otherwise, and that'll actually make their life easier later in life.
Easier.
Yes,
absolutely. Knowledge is key, and education is key. So as we wrap up now, you've been so good. At times it's just been going, and we couldn't even feel it. Just one or two questions that I skipped, and I want to go back to it real quick. And that's when we were talking about intimacy. And one of the things that you mentioned is you have certain certain prescriptions for certain issues depending on what's going on with the male. We normally hear things about the blue pill, right? What are some of the side effects of that? Because we hear a lot of Bahamians that use this particular pill. Would you recommend this?
So with any prescribed medication, you don't take it unless you are actually prescribed it by a physician who's done a thorough history, make sure that they know your allergies, etc., and then they're going to monitor you to make sure that you're not one of those persons who have an adverse reaction, which they can always change. But erectile dysfunction, you treat the root cause. There's no point taking the blue pill if your diabetes is killing your erection unless we treat the diabetes. If you're low testosterone, and the reason for your low testosterone is giving you Cialis, Viagra, or Levitra is not going to help you. So always address the root cause. If it's an emotional issue, address the emotional issue. So as I said, erectile function is a manifestation of good health. We look at it as the canary in the coal mine. So you always want to put the canary down in the coal mines to see if someone's going to potentially have that silent killer of carbon monoxide before the coal miners go down into the shaft. Erectile dysfunction is a canary for something going wrong in your actual bodily system, whether it's your vascular system, your cardio system, whether it's related to diabetes, high cholesterol, hypertension, etc., or low testosterone or obesity. So
could it just be work stress?
It can be, but we still need to rule out other things. Right. In many cases, it's more than one thing affecting it.
Yeah.
So for erection, you need a nerve supply, you need a blood supply, you need a hormonal issue with testosterone, and there's the emotional, psychological issue as well. So you need those four things. In many cases, there's maybe two things going on at once. So taking the blue pill will help, but it's too much. Too many men I see are seeing me after they've diagnosed themselves, gotten a blue pill from somebody, and after 3 years it stopped working. They want to know why. They've developed a tolerance? No, you haven't developed a tolerance. You haven't addressed the issue that's caused you to have the erectile dysfunction, and that's become even more profound. And the nerve supply that you may have had that would have been mild 3-4 years ago is now profound, and now your eyesight's affected. Now your kidneys are affected. It's done untold harm to your heart. So use erectile dysfunction to look at your health and to seek help, because that may prevent you from having further ill health effects and manifestations that affect other organs of your body as well. And then the number one erectile dysfunction complaint worldwide is premature ejaculation. 1 in 3 men have premature ejaculation, which is devastating. 1 minute, you're done. Particularly for a middle-aged man, you may take many hours to recover and go another, and then it's 1 minute, you're done. It's not a laughing matter. It's nothing to be embarrassed about. 1 in 3 men, that's 33% of the population of all ages, are affected by that. And too many men live in. We can give you medication as urologists. You can get 15, 18 minutes.
Wow.
And men do not realize it. I've seen men, and even with word of mouth, because we're a small society. They might not mention the name. My colleagues told me, my cousin told me, I was dealing with premature ejaculation 20 years. You got him 18 minutes. Please, doc, help me. A week later, they come and they thank me. It changes their life.
Of course.
Yes.
Wow. So are there any healthier alternatives to prescription? I don't know if you were able to talk about like any natural things that men can do without having to get a prescription.
Well, it all depends on what we're dealing with. But for example, even for benign prostate hyperplasia, you can have a natural supplement called saw palmetto that works very well with helping you basically have a good urinary stream and empty your bladder completely. So yeah, there are natural things that can help. The most natural thing is to have a normal body habitus, to eat healthy, to have exercise. That will help in every aspect of your life.
Okay. All right.
So that might prevent you from, we talk about childhood diabetes and early onset of hypertension. If we address that and be proactive at the school age in terms of giving them physical education and getting them on the right diet, we can prevent 1 in 7 persons in our society in terms of adult being either pre-diabetic or diabetic, which is overwhelming.
Absolutely. Are there any closing remarks or anything else that we may have missed that you want to be able to share with the listening audience about our men's health and how we can help them to be healthier
Well, always listen to your body. It goes a little bit further than that because there's so many conditions that you have no early symptoms. Make sure that you get your annual physicals. Make sure that you get exercise, that you eat healthy. If you're having stress or anxiety or depression, seek help. But the most important thing is do not be embarrassed to seek help.
Right.
Everyone's going to need to see, for example, a urologist at some point in their life, whether you're male, a female, or a child. So seek that help. That can be transforming. It can turn your life from darkness to light. Don't let your bladder control your life. Don't let erectile dysfunction ruin your self-esteem. Don't be overweight and let it affect the number of years you're going to have potentially on this earth. Don't let uncontrolled comorbidities like diabetes or hypertension leave you to an early grave or prevent you from having an enjoyable golden years as you're retiring because you've lost your eyesight, your kidneys are dysfunctional, you have issues with your nerves, you have congestive cardiac failure, or the list goes on and on. If you don't like taking pills, then take care of your health earlier in your life.
Come on. That's it right there, Doc. That's it right there. All right. So now can you share with us how you can be reached, recite your phone contacts, or if you have a website or your clinic where you're located?
Well, I'm a consultant urologist in the public health system at Princess Margaret Hospital. I do have a website, urologycarebahamas.com. It has all my contact information, but my main offices are at Oak Tree Medical Center, which is 5th Terrace in Mount Royal. And the number there is 322-145. My other office is at Family Medicine on Blake Road.
Yeah. Okay, excellent. So we can find you at Oak Tree Medicine Center, Princess Margaret Hospital. A doctor's office. I don't know. He said. Oh, you said Princess Margaret as well. Okay, good. Yes. All right, so I don't feel too bad. All right, so now, Dr. Pinto, thank you so much for being a part of the show today. I know that we were encouraged today. I know that we received the information that we needed to be a better helpmeet and a better daughter, a better mother, a better auntie to the men in our lives because of you. And we are grateful for your presence and for what you've shared. Now, this moment is going to be very quick. It's called our Talk to the Audience moment. And this moment is brought to you by Your Lane Life Coaching. And these are just nuggets that I would prepare prior to the show, depending on the topic. And some of these topics, some of the nuggets, of course, would be information would have already been shared with the professionals that we would have on the show, but because it's already been prepared, I end up sharing it again anyway. So very first nugget that I want to share is that we complain as women, we complain about our husband's weight and about their bad health, but yet we're the ones that are cooking all the greasy, salty foods. And so healthy eating habits start in the home. So as women try to cook healthier meals for our men in our lives, right? Let's try to ease up on all the salt, all the seasoning and all these different things. Let's ease up on all the oil, the fatty. There are the other alternatives. There's the air fryer. You can bake things. If you steam them with less. Maybe you can use coconut oil or avocado oil or something, or less of it, not very minimal, olive oil, etc. But I had a nutritionist that came on the show, Nurse Kate's. And she said to us, it's not necessarily what you eat, but it's the amount that you eat. So good. If you're going to make the baked peas and rice on, Father's Day next week, right? Is it next week? The crab and rice then, and the chicken and the macaroni and coleslaw, let's try to give them smaller portions. They're not children. I understand that quite well. But we want to, have a conversation prior to taking out their place, respectfully so, to say, okay, well, I care about your health and this is what I want to do. And of course, if this is what he wants, then go ahead and give him the bigger portion that's what he wants. But if he respects what you're saying or what we're saying, to say we want to make sure that you eat healthy, or if you do eat this amount, we want to make this type of food, we want to make sure that it's not as much as you used to eat it before, because that would help a lot with weight gain, diabetes, high cholesterol, all these other symptoms that we seem to have here, especially in our country. All right. Our second point is to give him space. And we're talking about the mental part now. When he comes home from work, it's a stressful job. Dr. Pinto spoke about, law enforcement officers that come in to see him, but there are so many other people. You have teachers and all these other professions that are very, very stressful, and areas where people are pulling on them whatsoever. So sometimes when your man or the man in your life comes home, give them time to catch themselves. Give them a little bit of space. Don't just come and rush up on them and throw the baby in their hand and say, "Hey, that's you, tiger it." Give them some time. Give them some space. Beats mentioned something, and I think that this, even though we laughed about it, this is really a thing that I noticed. Is he was extremely serious when he said this. If it means having to find solitude or solace in the restroom, give them that space. Give them that space. For their mental health, give them that space, please. You don't understand how important it is to be able to, if they're already stressful, if the job is already stressful, wherever they work, it doesn't matter. I don't care what profession they're in, and then they come home to chaos. You don't want to be the one to stand in the midst of their peace or be the cause of them not having peace in their home. I don't care how many kids you have. I don't care if they're all grown. You may just be by yourself. Whatever it is, when he comes home, no nagging. You can ask, "How was your day?" Don't be a nag. Throw the garbage out. I hear these things as a coach. I hear these things all the time when men come to me and they complain about what their wives are saying and doing. And then women come to me crying about their men. Oh, we're going to go there. About how their men are withdrawing themselves from them. Watch what you say, women. Let us, because I'm a part of us, all of us. Let's watch what we say. Some men holding things until death. And the things we say to them over time messes with their psyche, believe it or not. Sometimes when we say things, we may say, "I apologize, I'm sorry," or whatever. You have some men who still hold on to that. You have some men that when you place them in a situation, it's a trigger for them because of what you would have said 5-10 years ago. Yes, these things happen. And ladies, can we try our best to stop rejecting our men? We're going to talk now about intimacy. I understand when we are going through, our menses and we're going through some things with our bodies, and we can understand that, hey, we can't do this at this time. There are alternatives. I'm not going to go there today. But if you believe that the genitals are out of order at the moment for the 5 to 6 days, there are alternatives, and you use your discretion on that. But when you see a man have to come to you over and repeatedly, and you complain about what you can't do, you have a headache, or you too tired, or I deal with these children, and all these different things, then when it's time for them to really come and approach you, they are afraid. You are messing with their ego. You are messing with their confidence in bed. They don't even want to touch you. And then you come complaining and crying to therapists and coaches and all these other people that my man is not touching me. Why? Because you keep on rejecting him. He's tired of hearing the same things, or something is wrong with your head, or you're just too tired. Your body is his body. His body is your body. Y'all have to get it together. Stop rejecting your man. Find ways to build the trust and intimacy. And Maggie Bain spoke about this last week. You got to build that trust. You got to keep and intimacy means everything. I mean, that's you being open and honest. It ain't just really sex, It's the mental, it's conversations. It's being vulnerable with each other. These are things that are so important to a man's health. Cater to his needs too. It's not about us all the time. Sometimes he wants you to be the initiator. Sometimes he wants you to be the one to approach him sexually. Sometimes he wants you to take him out for dinner. He wants you to touch him. He wants you to give him hugs and kisses. Sometimes, believe it or not, there are some men who love flowers. He wants you to bring home a gift. He wants you to affirm him. It's not about us, ladies. You want an effective, you want a wholesome man. Understand that he has emotional needs as well. Understand that he has physical needs as well. Okay? Work on a budget. Let's talk about the finances. We didn't even know. I didn't want to approach finances with him, of course, because he's a medical doctor. But like he said, he hears everything. So even when it comes to a man's career, midlife crisis and he's thinking about the finances, and he did bring that up when he's speaking about, having to pay for children's school fees and all these other things. Let's do our part as women to help with things like budgeting. Be a wise woman and help him save. We don't have to go get our hair done all the time. We don't have to go get purchase shoes and things all the time. Let there be, if possible, a budget for that. Let's be wise women in our finances to give him less stress. If you feel as if he is not strong in that area as far as saving is concerned, then you take up that role and you help. Have something, have Excel sheet or have some book or something about that, so you're able to record the various things that you purchase every month. But there has to be something, so that is less arguments for you in your house. Because we know that, hey, a man wants to come home at the end of the day, his finances straight. He ain't got to worry about BPL cutting off their light. He ain't got to worry about someone telling them coming home and the phone off or whatever. That causes stress on a man, because to him, his life is all about making sure that his family is secured. All right. And my final point as women is we pray for our husbands. Let's pray. Let's cover them in prayer. Not the Father, lay me down now and lay me down to sleep prayers, because that ain't gonna work in this day and age. That's not gonna work. Last week when I was making up the bed, the Holy Spirit said to me, if my husband was depending on my prayers to save his life, will he live or will he die? If your husband was depending on you to save his life, or depending on your prayers to save his life, will he live or will he die? Let that sink in for 2 seconds. Because there's so much that men go through, and sometimes they don't share it with us. Sometimes they're not as vulnerable, so they hold things in. We hear it all the time. If they are at a point where they're afraid to even go see a professional, imagine how many things that are built up inside of them. So we as women have to be warriors for our husbands. Cover them, especially those who are in any field, because I was saying law enforcement, but I don't want to discriminate. Every field, because it's simply as simple as coming out of your house into a car, going to the next destination. We don't know what can happen. You have to cover him in prayer. Cover his health. Cover his mental state. Cover everything concerning him. You want to ask for protection. Ask God to protect him, and ask for angels to go before him and set crooked paths straight. Cover your husband. Don't be so lazy. This is not the time to be lazy in your prayer life. And of course, we're talking about our children and everyone else too. But we're specifically speaking about us as women covering our husbands or our men, the men in our lives. All right, so I'm going to stop there. But if you need coaching in any area of your life, including how to be a better spouse, please go to my website, www.yourlanelifecoaching.com, and schedule a booking. I would love to help you. I would love to help you improve your life and your relationship. And I'm so happy to have with me Dr. Pinto once again. And I know for a fact that he's going to be overwhelmed with clients calling him, patients calling him next week, starting on Monday, because I want you all to go ahead and give him a call. This gentleman is not only professional, he's down to earth. He's a avid Catholic, a believer. Yeah, he's a believer, right? So you ain't just putting your hands in every. I mean, you could be professional, don't have to be a believer. So don't get me wrong. But I'm just saying for those, I know my audience, right?
Yes.
I'll leave that there. All right. So go and see him. If you are having issues in any one of the things that he mentioned today, go and see Dr. Pinto. You have 4 different options, 4 different locations to see him. Doctor's Hospital, Princess Margaret Hospital, Oak Tree Medical, and Family Medicine Center. You can't go wrong. Beats. You good? Any questions? Good. So today's show was brought to you by Airborne Freight and Cargo Services, John Shoe Store and Accessories, Your Lane Life Coaching, Bahama Odds and Ends Party Supplies, and Johnson & Johnson, distributed by Lowe's Wholesale. Next week's show, before we leave, I want to let you know that it's entitled Life Without My Father. a show that displays men who have accomplished much after their father's passing. This is a show to honor their fathers who have gone ahead of them and to let others know that even if your father is no longer with you, you can still accomplish great things in life. All right. You want to tune into that show next week. It's going to be bittersweet because, of course, I won't be surprised if there need to be some tissues handing out during that show. However, we're going to honor them because, you know, if it was not for their fathers, then they wouldn't have been where they are today. So thank you to my producer, Beats. Beats, you've been well. I absolutely love when you're in studio. Thank you to my Facebook audience who've been keeping it real the entire time, our continued listening audience, and our first-time listeners. Thank you so much for tuning in. Please follow the page Your Lane Life Coaching on Facebook to get all of the updates and goodies from the show, and then go to Coach Trish Hanna on YouTube to watch the previous shows. Please like and subscribe. Thank you once again. I kept saying this, but I have to keep on saying this. Thank you, Dr. Pinto. You've
My
been
pleasure.
marvelous. You've been marvelous. I pray that you all were empowered, educated, and encouraged today. And until next time, happy Sunday, everyone.
Thank you very much for having me.